The what?
Your sister?
No, no, it's not my sister. Blood pressure. It's a coworker.
Close.
Oh, okay. Gotcha.
，I do the video.
She's doing a video.
I do the video.
Well, I mean, you're missing the whole outfit.
Oh, I put on the YouTube. Yeah. Perfect. Good. All right.
But if we ever run across one that's not travel over there, I'll go get the picture. I'm going to go get you guys some business and send it over. Thank you for being here.
If they need to get connected with the VA, they need to raise income, like if they have like savings that they're going through. Oh my goodness, just getting
Yeah, I suppose it is like a percent. Something like a friend coming and trying to get
Do you know about
into the
that?
system.
That makes a difference.
Yeah.
Okay. Well, we found out that a lot of our
I know where I'm coming from.
we found out that a lot of our
They do breakfast here every day, seniors, and you can order. I said, okay, I can walk over here on, get my exercise, and get my breakfast, walk back, and I'm ready to go to work, right? Sure.
We do car repair.
I don't.
Well, let's try to make it a little so basically, we're Tri-City is actually we're community based, but we continue on this operation. Yeah. That is down below, and then I have on the top of the trying to figure out how to connect
Oh, basically they also take care of almost everything, all the way from cardiology, pediatrics, and all stuff like that. And if you want to have it to get yeah. We also have the con card, yeah, just in case you'd like to. Thank you.
Hey, morning.
Would you like some,
I just have my blood pressure test.
yeah, would you like one?
No, I just have one. I just have one.
Okay.
So where'd you located?
We're located. We also basically we have 3 locations. We have one right here at Maury, one at Warm Springs, and one at Hayward. So.
Oh, Hayward. What part of Hayward? I live in Hayward.
I'm not exactly sure where
you work,
but if you look at this calling card, if you check that the addresses right here, it'll tell you where to find the offices.
Okay.
And also
Calaroga, I know that's close to the St. Rose.
Yeah,
St.
true.
Rose.
And also in our office, we take care of almost everything, all the way from internal medicine, orthopedics, cardiology, almost everything. Yeah, we almost take care of everything. For you.
Very good. Okay.
And for the insurance, we basically take care of everything, whatever's inside there.
Sure. Okay.
So yeah.
Very good. I will pass out to the community.
Thank you.
Thank you.
Thank you.
Bye.
In most cases, absolutely. We're working hard to make sure that whatever doctor is currently providing Medicare and Medi-Cal services to the people that are being enrolled with us, that we're reaching out to them and trying to bring them into our network so they can continue to provide both Medi-Cal and Medicare services. There's going to be a few cases when we won't be able to meet that need, but that'll really be because the provider doesn't want to be part of the Medi-Cal managed care system, or if the provider doesn't meet quality standards in order to be part of our network. Those are really the 2 instances where the cases where people will not be able to keep their provider. If people are already in Kaiser's Medicare Advantage program, Senior Advantage, people are asking us, are they going to be able to stay with Senior Advantage? And the answer is yes. For the first year, there is no change in their enrollment. They'll be able to stay in Kaiser Senior Advantage. That year is going to give us time to try to enroll Kaiser into the dual demonstration so that we can make sure that that's true forever. Premiums, monthly co-pays, etc. Are people going to have to pay these? And the answer is, in most cases, absolutely. There's going to be no premiums and no monthly fees in this program. There are some very minimal, very modest co-pays for prescription drugs that currently exist, so that will not change. Those same co-pays will still exist. And for certain folks that are in share of cost Medi-Cal, that program where they actually have to pay in order to be eligible for Medi-Cal, that share of cost will continue as well. We also get questions about prescriptions. Are people going to be able to stay and to maintain their same medications? And most medications are on our list, and we're all in sync. For those few drugs that are not on the Alliance list, we're going to be working hard with the providers to make sure that the members that are enrolled in the Alliance will end up getting the same class, very, very similar drug benefits. If not exactly the exact same class, and we will be working with the doctor, your doctor, to make sure that that transition is as smooth as it can be. In terms of in-home supportive services, a lot of folks who receive this, the program is self-directed. The member gets to decide who the IHSS worker is, they get to control both the hiring and the firing and the supervision of their IHSS worker. That will all continue. People will still be in complete control of those aspects of IHSS. It'll still be run through the public authority. I know that they're here, and the enrollment and eligibility determinations will still be done in the same way. So under the demonstration, none of that changes. And we did want to reiterate that if you want some information, please pick up our 2-pager that's over the hill. And it also gives you a website where if you have other questions, you can email, and you'll actually get Layla and I, and we'll be responding to any questions that you have and that you email us. Is it okay is there any questions that we might be able to take really quickly now? Yes.
Does this require the government to put out more money?
The question is, does this require the government to put out more money? No. The government, I mean, whether it's the state or the feds, there really isn't, I mean, that's kind of one of the things that's driving this. Is the goal is if care is better coordinated, if people are put in settings, you know, if they can live in their home with certain services instead of living in an institution like a skilled nursing facility, that there will be cost savings there. So the goal of this is to save money as well. So no additional money from the government. Any other questions? I'd really like to encourage people, even the people back there at the tables, if anyone is listening, to, if there are questions that you have or people that you work with have, to email us at the email address that's on the back of this form. You know, the more questions we get, the more we have an idea of what you need to know. We really want to, we're working hard to provide you with the information that you need, so you know about these changes and you know how it will affect you. Any questions? And again, if they come up later as you're walking away, or as soon as we walk away and you think of something again, please pick up one of these documents, and on the back, the very last question, you'll see in blue, you'll see an email address where you can send us your questions.
Is this connected with Obamacare?
The question is this connected with Obamacare?
Very tangentially. The Affordable Care Act has a provision that creates an office, this is such a technical answer, I'm going to apologize for that. They created an office that serves both, that looks at integrating both Medi-Cal and Medicare services. So they created that office, and that office that's looking at coordinating both those services ended up doing this. But there is authority even without without Obamacare to do this as well. So the answer is sort of yes and no.
Thank you very much for your time. And remember, we have a table with the purple tablecloth, Alameda Alliance for Health, over the hill. Thank you.
Thank you to Layla and to Aaliyah, which I don't know about you, but when we think of over the hill, we look over there and we think about Livermore, Pleasanton, and Dublin. You don't really have to go that far to get their information sheet. Their table is just opposite the senior center and across the parking lot there. So purple tablecloth. And now we're going to have a Zumba demonstration with Maria Megsake. Is our Zumba team here? Yay.